Hi, I'm Tom Bagwell, and welcome to Hello Health, a weekly education and information series in partnership with the Ochsner Health System and Humana. Today's topic, common foot problems. Our guest is podiatrist Brett Sorensen. First, some background. Let's start there. Dr. Sorensen received his medical degree from Des Moines University College of Podiatric Medicine in Iowa. He then completed his podiatric surgical residency at the Ochsner Clinic Foundation. He is board qualified with both the American Board of Foot and Ankle Surgery and with the American Board of Podiatric Medicine. And it is our pleasure to welcome Dr. Brett Sorensen to Hello Health. Good to have you with us on the program.
Yeah, I appreciate you having me.
Thanks for being here. Now, you didn't start off wanting to be a podiatrist. In fact, you started at the other end of the body, right?
I did. My original plan was to be a dentist, and during undergrad I spent about 60 hours shadowing different dentists, and one day I was sitting there and all of a sudden decided, you know what, this isn't for me. I don't want to do this. So I talked with a buddy of mine who happened to be going to podiatry school, and he set me up with a podiatrist that I could shadow. Turned out I really enjoyed it, so I just went with it.
Did you have foot problems at any point early in life? Any family members? Was that part of getting into it too, or no?
No, it really wasn't. To be honest, I didn't even know what a podiatrist was at the time. I had to ask him what a podiatrist was, what do they do, and he explained it to me. It's something that I took hold of and went with it. First
thing we're going to talk about tonight is bunions. So first of all, before we even talk about what a bunion is that probably the biggest, most amount of cases you're treating?
It's probably my biggest surgical case. I do most surgically, but you know, we see a lot of different things.
So what is a bunion? And you don't always start off with surgery. We want to talk about that too.
No, so a bunion is basically, you'll notice a little bump on the side of your foot. It starts to get bigger the older you get. Oftentimes people think that's a growth or something growing out the side of their foot, and they call it a bunion. But really what it is that first metatarsal, which is the bone right there in the foot, starts to drift medially, and the head of that bone is actually what's poking out of the foot that you see. Basically when that happens, the big toe also starts to drift the other way, or goes the other way, and starts to push up against that second toe. And that's the basis of really what a bunion is.
Is it part of the natural aging process, or is it impact related?
So it's not natural. So not everyone's going to get a bunion. It's basically you've got an imbalance of some tendons that they start to pull the bone one way a little bit more than another. Some of it has to do with a person's foot type, whether they're flat-footed. Sometimes it has to do with just your genes. You know, you get it from your parents. If your mom has a bunion, maybe you're going to have a bunion. Other times it can happen because of poor footwear, wearing high heels and things like that can cause these bunions to develop over time.
Yeah, before we talk about treating them, let's talk about preventing them. So you mentioned staying out of high heel shoes.
Yeah.
No problem for me there. But are there any other things we should be avoiding?
You know, just really you want to make sure you're wearing a good supportive shoe, especially if you have flat feet. You want to wear something that has a supportive arch to it. Sometimes arch supports help a little bit. To make sure that it kind of stays where it's at and support that foot as much as you can over time.
All right, we're going to talk about good support and picking the right shoes and all those other things towards the end of our program. How are bunions treated? And let's start with the conservative approach.
So there's a lot of different things we're looking at. We're looking at what's causing the pain, first of all. So oftentimes it's the pressure causing the pain. The pressure can come from a couple different places. You know, as we talked about that bump that grows out on the side of the foot, that can rub in the shoe, and just having those shoes rubbing on it and becoming too tight can cause a lot of pain in that area. And so the easy approach to that is say, well, let's get some wider shoes or open-toed shoes or something where the shoe's not rubbing as much. Sometimes that pain comes from pressure from that first toe. We talked about how the big toe kind of starts to drift medially and pushes up against that second toe, and the pain can come from the two toes kind of butting up against one another. So when that happens, very simply what we want to do is use some of these paddings and toe spacers, things like that you can get over the counter or on Amazon. They're all over the place. But you just want to get them and kind of put them in there to kind of keep the two toes separated. As we talked about before, orthotics can help, especially when what happens with the bunion, that big bone that's kind of sticking out, it's meant to sit straight. What happens, unfortunately, as it drifts out is that the pressure in your foot redistributes along that second metatarsal. And you can get calluses that develop that become really painful on the bottom of your foot. In those cases, you know, the orthotics kind of taking that pressure away and putting them back at the arch can really help. So there's a lot of different ways, but most of it has to do with taking pressure away from the points of pain.
When is it time to, let's say we try some of those approaches and they don't work, so when is it time to start considering surgery?
That's a good question, and it's a question I have, conversations I have with my patients all the time. When is it right? Do I want to do it now? Do I want to wait? Or do I even ever have to have surgery? What I always talk to them about is how much is this bunion affecting your lifestyle? Yeah, are you able to do the things that you want to do and do those things pain-free? If wearing wider shoes and wearing toe spacers and doing those things helps you so that you can do the activities you want to do, whether that's run, whether that's just walk around pain-free, whatever that level of activity is that you have in your life to maintain that activity, if you can do that, you probably don't need surgery. But if the bunion is affecting your life and you can't exercise, you can't get around because of the pain that it's causing you, and none of these conservative approaches are helping, it's time to start to consider maybe it's time for me, maybe it's right.
Okay. One of the viewer questions we received was this one: if I'm a marathon runner or a triathlete, am I doing more damage? Is this the sort of thing that could cause bunions?
So it likely isn't going to cause the bunions. You're going to get the bunions because of, as we talked about, there's some tendon imbalances, maybe genes, things like that. But it can definitely hasten the bunion, helping it to come along a little faster. And if you're putting a lot of stress on that joint, because as that bone moves over to the side, sometimes it puts a lot of stress on that joint. And if you're not moving it correctly, you can cause arthritis and other problems within that toe joint over time that can make the pain worse. But it's not something you have to rush into. If you're running marathons and you're not in any pain and it's not bothering you, keep running those marathons and keep going until it does become a problem.
Very good. So let's walk us through, if you would, bunion surgery, and then we're going to talk about the recovery and what that entails. But first, the surgery itself.
Yeah, so when it comes to the surgery, first, before we even get to the operating room, we have to discuss a few things on preparation. And so you really have to decide when is this right for me. We have to remember this is an elective procedure, meaning that you don't have to do this at any certain time. So you take your time.
That begs the insurance question. Will insurance companies pay for bunion surgery?
Yes, they do pay for it.
Okay.
They will pay for it.
Good.
So when you're ready, when it's right for you, you make the plan, you make the date, you work with your work to get the time off or whatever you need to do to make it so that you can comfortably have the surgery and have that time to recover. You have to think about staying off of your foot for a while afterwards, because when you're recovering, you're going to be in a boot, so you got to think about taking that time. Other things to consider: if you're having it on your right foot, you're going to be in a boot for a while, so you can't drive with that boot on. So these are all things we have to talk about first in our planning and our preparation for having surgery. Once we're ready, we've prepared for it, we've thought about it, we've decided yes, we're going to have it, and we've made those plans, then we can start discussing which procedure is right for me. When it comes to bunion surgeries, there's literally books, hundreds of books written on them with dozens of different types of procedures you can have. And so there's a few things that we look at when we're deciding about surgery, deciding what type of surgery we want to have. And so that's something we kind of have to just sit down and discuss in the office and look at the x-rays and talk over.
What are the different types of surgeries, and what would determine what is right for each patient?
So that's a good question. When it comes to the different types of surgeries and the planning, we're going to look at a few different angles. We're going to look at how far that first metatarsal has drifted over, so how severe the bunion is. If the bunion is not very severe, maybe you just have a little bit of a bump, we can do a procedure that's a little less invasive, maybe a little bit more on the head of the metatarsal. We move it over a little bit, and in that case, your recovery is going to be shorter. It's going to be a little easier to get back on your feet. Sometimes if it's a really bad bunion, we're going to have a wider angle between the first and the second metatarsal, and we're going to have to move that over a lot more, and we have to do that more along the base of that bone. And that, because of where we're doing it, you're going to have to be off your foot, non-weight bearing for longer periods of time to allow that to heal. So deciding which procedure you do also affects how long it takes to recover. And all that is dependent upon how bad the bunion is. So it's something we would go over definitely when we're in
the doctor's
office.
Brought along some x-rays to show us, and this might give us a better idea, because we could look at each of these x-rays and you could say, okay, this is what we would do here, or this would be my recommendation here. So let's take a look at some of these x-rays, doctor.
All right, so what we got here, here it's going to be, so here we go. This is the same foot, preoperative and postoperative. And what we're going to do is we're looking at how wide the angle is, as we talked about, between this first metatarsal bone and the second one.
So the difference here.
Yes,
right.
Between those two. And here in a second, I'm going to draw these lines and show you exactly what we're talking about. So if you take this, you're going to run a line right down kind of the center of that bone from there. Here it comes all the way down. Kind of just run it down the center there, and then we do the same thing along that second one. That gives us an angle. Interestingly, the normal angle for someone is going to be about, anything less than 8 degrees. So we're looking at this angle, it's about 16.4 degrees here, so twice as big as your normal angle. It's a pretty moderate to severe bunion. And so if you look over here on the other side, this is the surgery I chose to do, was more along the base. We talked about sometimes if the bunion is bad, over 14 degrees, we want to kind of come more towards the base here. And so what we did here is I fused the joint back here with this plate and these screws, and I pushed that bone all the way back over to where it's more straight alignment where I want it to be. I shaved down the bump along that medial side that people notice that bothers them. And then we fused it with these, as I said, these plates and bones. And if you look at the change in the angles here, after we're done, we're looking at about a 7-degree angle, as it says, 7.1
and 8
degrees.
is normal.
And 8 is anything under 8. Yep. So we brought it from 16 to about 7 degrees. So that was a pretty good correction there. And if you look at the joint alignment too, what's important here is that here you can see that the joint is completely out of alignment. The toe is pushed over. Here we're back in perfect alignment, and that joint, you can see the joint space there again.
Two pieces fitting, looking like they belong, like they fit together.
Exactly.
Right.
So yeah, so we pushed it over, we straightened out that toe, and we got a really good, satisfactory.
This surgery pretty aggressive, it looks like. About how long would a surgery like this take?
So this one right here, you're looking at being about 4 weeks. How long does it take to do the surgery?
Yeah, and then the recovery.
Yeah, so to do the surgery, you're looking at about 2 hours is what you're going to have. So we have you come in. It's going to be an outpatient procedure, meaning that you come in that morning. We're going to do it in the surgery center. We get you all ready. Once we roll you back to the operating room to the time that we get you back out, we're looking at about 2 hours.
Okay. I'm asleep during all this, I hope?
Yeah, so you are. You're going to be asleep during the whole thing. I also do a little block with some lidocaine, some numbing medication, so that when you wake up, it's numb and you don't feel it right away. Eventually that does wear off, and we give you some pain medicine and have you elevate your foot, ice it, and just take it easy for a few days till that pain kind of goes away and recedes a little bit.
And someone else is with you. Someone else is driving you home that day.
You got to have someone there with you. Yeah, you're not able to drive yourself home after that.
Right. What are some of the complications that might develop after surgery? I'm thinking one might be people just not listening to stay off of it, right?
Yeah, that's going to be a big one. If you start walking around on this too early, or you take that boot off and start walking around, you can have some major complications where that bone moves around. The screws aren't going to hold it. The screws are going to hold it temporarily till you're able
fuses,
to, yeah,
right.
till it fuses. But in the meantime, that boots your protection. So if you take it off too early, you're going to mess things up. Other complications that can happen, there's always complications with possible infection. Something we watch closely for, especially with the hardware and the screws that are under there. We don't want to see any signs of infection. Knock on wood, that hasn't happened to me yet, but it's definitely something that can happen, and we keep a close eye on.
How soon is the patient coming back to check with you to make sure everything's healing well, and how many times will that happen before you say, boot off, good to go?
Yeah, so my protocol is that I have you back 1 week afterwards. This is one where we're going to take the bandages off, we're going to look at, we're going to check to make sure there's no signs of infection, and we're going to make sure that everything's healing right and looking good. We want to stay on top of it. After that, we wrap it back up for 1 more week. You come back at the 2-week pro-stop. At that point, we're just going to take out the sutures from the incision. You're able to shower at that point. People are pretty happy about that, being able to get it wet. And then, most of the time, depending on the procedure, but most of the time at that 2-week mark, you can start walking as long as you're in the boot, putting weight on it and walking around. And then I have you come back at 6 weeks, so 4 weeks after that. At that point, we take some x-rays to make sure everything's healed properly, everything looks good, and we get you into a tennis shoe, back into a good supportive shoe at that point. So it's about 6 weeks into shoes. I'd give it 3 months till you get back to running and doing high impact activities though.
Not too bad. So what is hammertoe? We talked about bunions. What is hammertoe and why is it so painful?
So hammertoes are basically tendon imbalances in the smaller toes. So we've talked about that big toe and how it moves with the bunion. Now we're going to get to the smaller toes. There's a lot of ligaments and tendons and muscles that come together and join together right there at those little toes. And all it takes is one or two of those to be a little bit off, and it starts to pull more than the other ones, and it starts to hammer and push those toes down into what we call a hammer toe. You know, it's something that is most of the time painful, again, due to pressure. So what we're looking at is that hammer toe comes up, we get contractures at different joints. The most common ones are going to be at what we call the metatarsophalangeal joint and the proximal interphalangeal joint. It's basically where the toe touches the foot and then the next one over. And it hammers up and then the toe hammers down. And what that creates is it creates a little bump on the top of your toe where it rubs in the shoes. And that's the most common complaint I see with the hammer toe is that, hey, every time I put on a closed toe shoe, this thing is rubbing up there and it's giving me a lot of pain up there where it does. Other things that can happen is that it will pull the toe over to the left or the right, and we get those toes that crowd together and push up against one another. This all causes different calluses and corns, and these can be quite painful to any kind of pressure.
What is it that causes this condition?
You know, again, it's mostly tendon imbalances, and a lot of times it's due to either one of two things. Either you have what's called a cavus foot, which means that the foot has too high of an arch, or you have a flat foot. So on the other end where it kind of collapses and goes down, and all of that does is it creates an imbalance of either the flexors or the extensor tendons pulling harder than the others and contracts those joints.
So what's the treatment protocol for hammertoe? Do we start again with on the conservative route?
Always. So I always start conservatively before I move on to surgery. And when it comes to hammer toes, once again, it's all about pressure. We want to alleviate that pressure from those points that are most painful. One easy way to do that is to think about your shoes. Again, you know, if you're wearing shoes that are too tight or not deep enough set that they're rubbing on the top of the toes, you may have to go into a wider or a deeper set shoe. Sometimes people go into an open-toed shoes like a sandal, you know, and that's fine because it takes pressure off the end of that toe. Other things that can be helpful are going to be toe sleeves and pads, things that you can get at, you know, different drugstores where you can just kind of slip it up over the toe and it causes some silicone, some different padding to buffer where you're hurting between the shoe and the toe.
And if it works, those are fine, right?
Perfect, yeah. If that works, if you can put those on and you can walk around, you don't need surgery.
Is sometimes just buying a larger shoe part of the solution, and can that lead to other problems? Because you mentioned having shoes that fit well.
So you're not going to look for much a larger shoe, okay? Sometimes if you get too big of a shoe, your foot's moving around in the shoe and then you're going to have a whole bunch of other problems. What you do want to look for is how wide your shoe is and how deep set the shoe is. So look at the width of your shoe. If you have a bunion or hammer toes, your foot splays out and widens. So instead of wearing a D size width, you may have to go to the store and say, hey, I need something in an extra wide, an E or a double E. And you let them know. If they don't have it, find a store that does have it. Other things you want to look for, as I said, depth. Some shoes sit deeper than the others, meaning that you have more room from the bottom of the shoe to the top of the shoe where the toes are possibly rubbing on the top of the shoe.
What about surgery for hammer toe? Is that ever an option?
Definitely. So it's definitely an option. If you've tried all of these different treatments, you've tried the different paddings and sleeves and shoes and nothing's working and you're in a lot of pain because of those contractures, surgery is an option. And as we talked about before, I say if you can live without surgery, do it. But if it's affecting your life, let's go ahead and just get it taken care of.
And what does hammer toe surgery look like?
So what you're going to do is we really want to straighten out that toe. And because what happens with those contractures is that you got a lot of different tendons that are still pulling on there. Sometimes we have to lengthen one of those tendons so that it's not pulling quite as tight. We also want to take out part of the joint that's contracted. And oftentimes that's that proximal interphalangeal joint. It's the one that's just distal to where the toe connects to the foot. And we need to take part of that out so that it can come back down, and then we fuse that. So we put some hardware or some KY or something in there to fuse that joint so that way it can't contract again and it will sit and it'll stay straight. And it'll kind of come down in the shoe and sit straight again. Once we get that hardware in there and we get it set up, it can fuse that way and we don't have any problem with it.
And the recovery from hammertoe surgery?
So recovery for this, similar to the bunions, you're waiting for some of that bone to fuse and kind of put together and stay together, and that takes 6 weeks for bones to fuse. The nice thing about hammertoe surgery is from day one, though, you can walk on it. We're going to have you in a post-op shoe, and then as long as you're wearing that shoe, you can walk out that same day.
I was pitching in a softball game. I do that once a year,
Yeah.
and I pitched about 7 games in a row, which is crazy. And I was pitching off of a mound, and I came off there with the worst case of plantar fasciitis you can ever imagine. I mean, to the point I could put no pressure on my foot at all. So let's talk about plantar fasciitis. What is it? What causes it? And most importantly, how do you treat it?
I'll tell you, plantar fasciitis is the most common thing that I see in my office. I'm seeing plantar fasciitis multiple times a day. And really what it comes down to with plantar fasciitis is it comes down to strain and pressure on the bottom of the foot, that plantar fascia. To understand what causes it, we have to kind of understand what it's there for. So you have your arch, your foot arches, and that plantar fascia sits on the bottom of the arch and it helps to support that arch and keep it in place. Unfortunately, what happens is we like to walk around barefoot, we like to walk around in flat shoes, something that doesn't have a lot of support, and it puts a lot of strain and pressure on that plantar fascia. And it strains it to the point where we start to get inflammation, usually right on the heel. Okay, oftentimes what people will say is they say, okay, when I wake up first thing in the morning or after I sit around for a while and I put weight on my foot, I see a sharp, intense pain right in the heel. It's normally plantar fasciitis, and it just means that you've strained it to the point where now it's yelling back at you and saying, hey, you need to support me. So there's a lot of different ways that we treat this, but we want to treat it from 2 different places. We want to hit it with the support, so arch supports and supportive shoes to kind of support that plantar fascia, kind of let it heal on its own a little bit. I tell people if you have plantar fasciitis, you do not want to walk barefoot or in flats until that calms down. Always stay in a good shoe with good support. The other way that we're going to treat it is going to be we want to knock out that inflammation, get rid of the inflammation there in the area where it's really causing you the pain. And so there's really 2 ways that I do that. Sometimes we do it with some medicine you take by mouth, like ibuprofen or Aleve, an NSAID we call them. Other times it's with a little steroid pack that you take by mouth for a short period of time. If it's a really intense pain, sometimes we'll give you an injection, a cortisone injection in the heel, steroid directly into that area to help to calm it down.
I could have used you.
Yeah. Hey, I've been glad to help you.
And what about the rolling your foot over a ball,
Yeah.
softball, a tennis ball, something like that?
Sometimes that's what you're doing is you're massaging that soft tissue, and that can definitely help. Any soft tissue massage can kind of help work that tissue out and help stretch it out a little bit so that it's not so tight and not giving you as much problem. Oftentimes what I'll tell people to do is throw a water bottle in the freezer till it's frozen, take it out, and then roll it back and forth underneath your foot a little bit. It both ices it, which helps with the inflammation, and will massage it, kind of do the same thing, both.
Okay. Back to bunion surgery for a moment. This is another viewer question. Can you do bunion surgery on both feet on the same day?
That's a good question. I do not recommend it. I've seen it done, but it's very difficult to do for the patient because we got to think about recovery. This is a long recovery. You're not able to walk on your foot. So if we do both on the same day, you're going to be completely in a wheelchair or completely in bed for a period of time. And then when you are walking, you're going to have 2 big boots strapped to your foot trying to walk around. It's just very difficult. So if you need it done on both sides, what I recommend doing is doing one side, waiting at least 3 to 4 months till you're feeling good on that side, and then we'll go ahead and do the other side.
And very quickly, do most people who develop a bunion on one foot develop it on the other, or not necessarily?
Not necessarily. You know, if it's something that you got from your mom or your dad, then yeah, you probably will develop it on both of your feet. Sometimes people will get trauma that starts the process, and then or some other reason that that starts the process, and then that just the one foot bothers them, and the other foot they never have a problem with.
Go ahead. I'm sorry.
Oh, interestingly, as we talked about with the bunion, you get arthritis sometimes in that big toe joint as well. And if your arthritis is bad enough, sometimes we have to actually fuse that joint. And that's another treatment for bunions and for arthritis. That joint is just fusing the joint.
So arthritis is something also that's treatable in your office.
Yes, yeah, we see a lot of people with arthritis in the foot. It's something that we treat both conservatively and surgically.
All right. Last thing we want to talk about is getting It seems today, you can buy implants for your shoes. You can, buy arch support for your shoes. There are a million of them on the aisle. So which one is right? Gel, not? Do I have to take out what's already in my shoe so that there's not too much there? So what advice would you have for our viewers about finding? It seems to me that now you just pick. I wear a size 10. You just grab them and you run. There's no more fitting and all those important things that used to happen.
So
what advice do you have for us?
They do still have custom arch supports, which they will fit you for. They will take a mold of your foot for, and they will send it to you. They make it specifically for your foot type. Problem with those are they're very expensive, and they're not normally covered by insurance. And so usually I start with the over-the-counter ones you're talking about. You just pick your size, you take it off the shelf, you put it in your shoe. There are a couple of things that I look for when it comes to arch supports. Usually I don't recommend the gel. I just don't think that they're supportive enough. Oftentimes you pronate or you push right through it because it's so soft. What you really want to look for is more of a hard, almost plastic looking insert. It'll have something soft over it, and it'll really hold that arch up. Even when you put your full weight on it, it's going to hold the arch and stop your weight from collapsing that arch underneath it. There are a few brands that I like in particular. I'd walk you through it if you come and see me. We'd go over it, and I'll give you some definite recommendations.
Well, I went to St. Paul's, and you're on the North Shore, so you've just given me another reason to go back across the lake to be with you.
There you go. Come on up.
Dr. Sorensen, thank you so much. Really appreciate your time.
I appreciate you having me here.
Good to have you. I want to thank Dr. Sorensen for the education and information he's provided today and for his work in the Ochsner Health System. To make an appointment with any Ochsner physician, including Dr. Sorensen, or to register for any of our Ochsner Hello Health seminars, they take place almost every week across the greater New Orleans area, you can call the number right there at the bottom of your screen. Or you can send us questions by email too. hellohealth@ochsner.org. There's our address. You can rewatch this presentation or many of our other Hello Health programs. Just go to Ochsner's website at ochsner.org and type Hello Health in the search box. Our thanks again to Dr. Sorensen, thanks to Humana and Ochsner for making this program possible, and our final thanks, as always, is to you for your support of this program, Hello Health. We'll see you at your next appointment.